Okay, good morning. I just want to say that I'm very happy to be here. So my name is Hilde Van Esch. Maybe you have encountered my name somewhere. I'm a clinician, I'm a clinical geneticist working already my whole life on the X chromosome. I'm from Leuven, Belgium. And indeed, in 2004, we discovered the duplication first in a Finnish family. And then we looked in our database and we identified several other families, and so this was the beginning of this story. And I must say that we are now almost 20 years later, and there is already a therapeutic avenue which is opening, which is incredible for a genetic disorder, I can tell you, because I'm seeing a lot of other syndromes. And so I'm also very, very optimistic. Okay, so that's what I wanted to say, and now we can continue with Dr. Santosh from King's College in London, and I'm very curious to hear about how AI and the digital health can help and improve MECP2 duplication research. Please.
Thank you. Thank you. It's a real pleasure to be here. Unlike the previous talk, which is very scientifically driven with respect to genetics and so on, this is a talk which is just going to be about how we've developed the Center for Excellence in Rare Diseases using Rett syndrome as a prototype to discuss what can be achieved. So I'm a child psychiatrist. I wear two hats. I'm a clinician in the Maudsley Hospital, as well as I'm a professor in neuropsychiatry and psychopharmacology at King's. And so the way it's been set up is that I've got a clinical role, which is a combination of working at the Maudsley Hospital. I run the neuropsychiatry services in the Tadworth Children's Trust, which is a 80-bedded hospital for acquired brain injury in children. I also work at Great Ormond Street and see some complex children there, and at King's College Hospital. And I'm a professor at King's, and we also run all the clinical trials. Importantly, Reverse Rett, which is one of the parent organizations, are central to our functioning with respect to the CIP-RET Center. And Health Tracker is a company which helps us look at tracking medical data across time, and I'll show you some of the things which I developed originally, and it's spun out from the NHS as such. So in terms of what we do in the center, we've got a whole stream of rare diseases, which CIP-RET Center is one of the main parts of it. We, however, have other rare disease large cohorts like septoptic dysplasia, mucopolysaccharidosis, and acquired brain injury, especially to do with neuroinflammation and autonomic dysregulation, especially post-COVID. We've got quite a lot of them happening as well. Apart from that, we've got a whole lot of cases with catatonia, childhood onset psychosis, often with organic conditions, often having an underlying genetic issue which has not yet been identified. And our research revolves around quite a lot of different things, but fundamentally it's translational informatics, which helps us to group what we do quickly, and clinical trials. What we've identified with all of these conditions, it doesn't matter which condition we're talking about, one of the things that is really crucial to it is what we've called as emotional behavioral autonomic dysregulation. And it's because of autonomic dysregulation, a lot of the other things, including epilepsy being under control or not, as long as autonomic dysregulation continues, most of the other symptoms are very difficult to get it under control. So this is to show you how we set up the center for the Rett Center with the help of Reverse Rett. Initially, before we started the center, this is how the care was being organized. You can't see the thing, but you're actually having the community, you have non-biological therapists, you have a whole lot of things, right from wheelchair management to the feeds to other things and so on. And the whole issue was that it was the parents who were actually having to care coordinate everything, and this is the same in most rare diseases. And of course, then you have all of the biological issues being done here with all the various specialists being done involved here, whether it's a neurologist, a gastroenterologist, and so on. So what we did was that with funding provided by Reverse Rett, we established the center in 2019. We now have grown to becoming the largest center in Europe. We've got around 200 patients in who are being followed up in the clinic. It is the first center where it's a precision medicine-led intervention, and that's what we do. What we've identified is that across all rare diseases, one of the key issues that parents need help with is actually assistance in repackaging medical information in a manner that they can use it appropriately when they go to different specialists. So when you go to a neurologist, what is it that you need to highlight? When you go to a cardiologist, what is it that you have to highlight? And that we have identified as being a crucial issue that has been missing previously. And then, of course, the central care coordination, which is what the center does. So we take over care coordination and assist families to be able to manage things in crisis. And of course, we also manage the autonomic and other things. And we conduct trials, and including the gene therapy trials, which are going to start soon. So what we do in the center is that we start from clarifying diagnosis and profiling symptoms. We use sensor-based assessments so that we actually get information about various physiological functions. We get a whole lot of questionnaires which are used in clinical trials routinely as part of the thing, using the health tracker-based digital phenotyping. So the parents complete questionnaires, teachers can complete it, clinicians can complete it. And then after that, we have, in the health tracker, we've got artificial intelligence-led classifications that allow us to triage automatically to say who are the ones whose symptoms have got worse, who need to be seen quicker, and so on and so forth. If a parent completes a questionnaire, we get a clinical alert in real time, which then allows us to actually manage the patients better. And of course, then we've also added pharmacogenomics, which then means that we get to know at an individual level which medicines they are more likely to respond to, which medicines are they more likely to have side effects to, and so on. So all of this information then goes into a database, which then we use artificial intelligence to be able to understand what changes help improve symptoms. So as part of that, we developed the questionnaire called the Multi-System Profile of Symptom Scale, which is a trans-rare disease questionnaire, which actually allows you to get information across mental health, autonomic, cardiac, and so on. It's system by system we get information. This information is collected across all rare diseases in our center, which then allows us to profile patients and start seeing what works in one condition, can that be translated into another condition. And that's how we ended up learning how to manage autonomic dysregulation in Rett syndrome. It originally started from our work with acquired brain injury in an acute setting after a brain injury. What happens to autonomic storms? How do you actually manage that? And that's how we translated that into work within the Rett syndrome as such. And this currently, this questionnaire is being looked at by the FDA in terms of seeing whether that can be used as an outcome measure. So when you complete it, you actually have each of the items you can get to see what the questions are, and you get the ratings, which then allow us to actually visualize across time whether that makes a difference or not. So when you're looking at it, almost every patient who comes to the clinic, we are then getting a profile about their neurogenetic issues, behavioral issues, emotional issues, epilepsy, dystonia, spasticity, spine and mobility, nutrition, gastric reflux, and so on and so forth. So all of this information is being collected automatically in all our patients coming through. And it's done at least 2 to 3 times a year, so we've got a longitudinal data set that allows us to look at things differently. This is what we did during COVID, when it was at the peak of the thing. We developed, as part of the health tracker, we developed a very small questionnaire which allowed families to complete it. It took them just 5 minutes or so to complete. As part of that, it also had 2 questions, one on fever and the other on breathlessness. And as you know, in Rett syndrome, you have breathing difficulties already. So what we then were able to do is develop an algorithm that allowed us to start tracking fever and breathlessness. And as you can see, and this is in a cohort of over 100 patients, and what you can see is that exactly as the peak of the COVID hit, that's exactly when all the problems got worse in this group of patients. But what was useful for us is that this allowed us to identify who are the patients who needed to be actually actively managed, and so we would contact the A&E in order to be able to identify that this patient may have COVID, please do this X, Y, and Z, and so on. And we actually managed to keep most of the patients out of hospital during COVID. So that was entirely to do with the digital mechanism, which was based on a 5-minute questionnaire and an algorithm that allowed us to do that. So that is what I'm talking about in terms of how digital health can help rare diseases, because you do need the assistance of it rather than actually just looking at it from the perspective of things. Now, similarly, we also have an inbuilt system in the health tracker which allows us to look at medications that they've been on lifelong, which allows us to look at side effects and improvement and be able to automatically classify them as green, amber, or red. Those in red are the medicines that actually should be stopped if you can, because the risk outweighs the benefit. And of course, if you're in amber, you try and change dosages and modify it so that you can actually move things around so that you can get to the green, amber. So our entire philosophy is to try and get patients into the green zone so that you've got least side effects, maximum benefit, and this goes across all disorders. So this is why I'm just presenting it like this. And this is where we've got the objective evidence from the sensors that we use in the clinic. So this is to show you a sleep and awake state. So this is during waking hours. So you can see here there is a period when the stereotypies have got much more worse. This is a child with Rett syndrome. And then this is during sleep, and you can see sleep is disturbed 2 or 3 times in the night. And you can see that there are patterns where this red zone shows you that there's something happening which is actually increasing their stereotypic behavior, which is usually distress. Now, this then is the data from motor activity. This is just to do with the hands. This is electrodermal activity. This is heart rate variability, and this is temperature. And this light green zone is during sleep, and this is during waking time. And all of this is developed by our own data scientists in the clinic, so the algorithms have been developed there. And what you can see is that in this particular child, you can see that at night specifically there is an autonomic storm taking place. And so therefore, during the day you can't pick it up, but during the night time, as soon as the patient is going to sleep, you actually have, or trying to sleep, you have this huge thing. This is completely abnormal. This black line is what, below that is what is considered to be reasonably normal in an age-matched control. Again, you can see this is electrodermal activity. There are peaks that are happening which shouldn't be happening at all. And you can see different patterns, and we've learned from the different patterns to be able to identify what they could be and how we can manage that. This is to do with, this is across time, and you can see this is in 2020, 22, 23, and what you can see here is that in this particular thing, in 23, things have got worse because the heart rate is actually 106 on an average, and when we started off, it was around 85. And what you can see is the same thing can be seen here, that this particular child has got worse with respect to the autonomic function, as well as heart rate has got much more higher as time has gone on. So therefore, the intervention here needs to change, and we need to be using something like a beta blocker in order to be able to manage it. And these are all the metrics that come out automatically, which goes into our database, so that we can actually do some AI-related work. And here, this is just to do with electrodermal activity as such in a single child with Rett syndrome, where the blue is before treatment and the red is after treatment. And what you can see is that by just treating the patient with buspirone, which is a medication that works on the brainstem, and it's an anxiolytic, we've got significant improvement in symptoms as well as the electrodermal activity and normalized heart rate as such. And so therefore, our entire scientific quest has been to try and understand autonomic dysregulation to see how we can manage it. And so we published many papers on it. This is to define behavioral dysregulation, emotional dysregulation, and autonomic dysregulation in Rett syndrome and rare diseases. We've published the first paper where we've got normative values for Rett syndrome specifically, age and across age range, both during the day and night, which therefore now we can identify and say this particular child's values are outside the range, which was never present before, so we published that. We've got multiple publications about autonomic dysregulation in Rett syndrome, where we feel that it's right for us to view that as an outcome measure for clinical trials. And then what we did was we went one step further to identify whether we could, using artificial intelligence, can we separate out the girls who had just autism and complex multimorbidity without Rett syndrome versus those who had Rett syndrome. And what we found was that we could easily identify, it was the first AI-based study which could actually separate out whether you had Rett syndrome or you had autism spectrum disorder in girls. So this was published as well. And this is the last slide, I think, to say that we are now currently looking at developing a Center for Neurobehavioral Problems in Neurogenetic Syndromes, where you've got a biopsychosocial-ecological assessment, which is a comprehensive one in the beginning. After that, we are intending to develop very specific packages of care for wellness, adjustment problems, neurodevelopmental issues like ADHD, autism, and so on. And then after that, neurodegeneration, and also very specifically looking at things around newer treatments like gene therapy as to what is needed before they get into the study, because it's very clear that if you do not get the neurobehavioral problems under control, the chances of getting the optimization for transformative therapies is much lower. That's what we've learned from multiple different conditions. And so with that, I'd like to stop. Thank you.